Hi there, I'm Ryan Almenanza, student ID set 361790 for course MOAS 1401 of Clinical Skills at MNF S3, and today I will be presenting to you donning and doffing procedures, proper sanitization, disinfecting, and wrapping of instruments for a clinical. First step of this presentation will be putting on the proper personal protective equipment in a clinical setting, also known as donning and doffing. And the first step before every procedure is to wash your hands as recommended. 20 seconds, thoroughly wash your hands. Make sure to pat yourself dry with a paper towel or anything that will ensure that your hands stay as sanitized and disinfected as possible upon putting on personal protective equipment. Now, the first step that we are going to don to ourselves will be the isolation gown. Now, our next step will be our face shields or masks. For these flat ones, you want to roll around your nose, flattening it out with every surface of your skin. The last piece of equipment that we are going to don will be the sterile gloves, to ensure that no contamination will get through our sterilized gloves. Make sure that you work your fingers all around that. Once you're done, for the other hand, you want to ensure that only the sterilized part will touch the sterilized part to guide your other hand in entering this glove. And there you have it. That's donning. For doffing, we will remove each and every one of our equipment safely. For our gloves, it is most recommended that you touch with the sterilized part first. And for this one, you want to ensure that only the underside of the glove will be in contact to ensure that none of the contamination will get through your physical hands. And just wrap that all around your hands. For our masks, simply turn it around. And for our gown, you just have to untie it. Make sure that your gown is not as tightly wrapped around you so that you can remove it as easily as you can. And that is donning and doffing as our first part of the demonstration. Now the next step for this demonstration will be the sanitization and disinfection of used materials or instruments during a medical procedure. So as always, you have to use first and put on your personal protective equipment. And you always have to wash your hands. As always, dry your hands with a paper towel or air dry them in a non-contaminated hand dryer. Now put on your gloves. Now the first procedure upon sanitization is to separate the sharp instruments from non-sharp instruments. And always discard whatever material that it came from in a non-biohazard bag, which is usually yellow or red. Red is for incineration and yellow is for disposable. Now the first step upon sanitization is to rinse them under cold water. Contamination and biohazard contaminants can be able to get its way in every crevice and openings of a certain material. So make sure upon washing them with a sponge or a disposable brush, you get through in each one of them thoroughly. Now the next rinsing will be under hot water to completely sanitize them of any biohazard contaminants. Make sure that they are in a dry surface area, and you will pat them dry with a paper towel. This will prevent any rusting and dematerialization of the equipment that can be used for another procedure for the next day or after its sanitization. Now, dispose all of this away. And again, in a biohazard bag, usually yellow, for disposal. Dispose of your disposable sponge or brush as well. Ensure that there are no more contaminants present in the surface. Now, to cleanse ourselves, we must remove our personal protective equipment, starting with the gloves. And perform aseptic hand washing for at least a minimum 20 seconds. And again, to prevent spoiling of your disinfection, dry thoroughly with a hand towel. After disposing the towels, you'll reapply your new gloves. Now the next step after re-entering our gloves is to use a disinfection wipe to cleanse the surface area that we cleansed the contaminants from off. I'm using Clorox disinfection wipes. Upon that, paper towels to ensure that none of the contaminants will escape, and just thoroughly wipe clean. After cleansing, again, dispose the towels and the cleansing wipes to a biodegradable. Now, after disinfecting, we must ensure that our own will be safe from any contaminants. So, first step is to remove our personal protective equipment, starting with the gloves. And again, properly dispose of that. Next is our mask. And thoroughly hand wash for 20 seconds again. Now, after sterilization of our hands, we will now place the dry and sterilized materials and equipment to a designated area in order to prevent cross-contamination and possible reinfection of another surface area or airborne disease that may come in contact with this equipment. And that is all for disinfection and sanitization of equipment. Now for the last part of my demonstration, I will show you how to properly prepare medical instruments for autoclaving. As always, we first have to disinfect and sanitize our hands and prepare ourselves with the proper PPE. Now, the items that we need for the wrapping for autoclaving is first double ply autoclave paper. The instruments that we are going to use are forceps and surgical scissors and the sterilization strip, which would be placed later in the center of the pack, which will indicate if the autoclave will reach its proper temperature in order to disinfect our materials and equipment here. Now, the first thing that we always have to remember is that whenever a sharp instrument will be autoclaved, you must wrap it around some cotton, gauze, or cloth in order to prevent puncture. This will also prevent any sort of injury that is possibly obtained with the operator. Next, you always have to use cotton between unhinged instruments like this in order for the heat to penetrate through every crevice, like that. For our forceps, we also have to use a gauze. And then we put our indicator strip. And now we will start for the wrapping. Now that we have completed our autoclave wrap, we must now secure it with some autoclave tape. This type of tape can handle the high amounts of heat that the autoclave will be able to penetrate through the paper. And after that, we will label it with the contents, the date, and the initials of the operator who used it, which is me, in order to let staff members know that when the pack will be ready, I will be the one in contact. Now that I have finished taping, the wrapping, and the labeling of our instruments here, this is now ready for the autoclave, and that will be all for my demonstration for today. Thank you very much for watching.